Hi there, Jane here, Continence nurse and ambassador for ConfidenceClub. Thank you so much for sending in all of your questions for this incontinence webinar. This first part of our two-part series is dedicated to all adult-related incontinence questions. The next video will be youth-related questions. We received a high volume of questions, some of which I'm unable to answer as they required tailored medical advice. If you don't hear your question read out, this is likely why. Some questions were also quite product specific or service specific, which I passed on to be answered directly by ConfidenceClub's customer support team, who you would have heard from by now. We're ready to dive in, but please remember, my answers are general advice only and you must seek a personalised opinion from your doctor or medical professional. So let's get started. There isn't a single cure for incontinence, as it very much depends on the underlying cause. Treatment options range from lifestyle changes and pelvic floor exercises to medication and more invasive surgical procedures. It is best to consult with a healthcare professional for personalised advice. Pelvic floor exercises can be effective at any age, provided they are being done correctly. Whether they are effective at improving incontinence very much depends on the underlying cause, but pelvic floor exercises do tend to be the first line of treatment for most types of incontinence. There are a number of alternatives to disposable continence aids. There are washable, reusable, absorbent underwear available on the market, which look and feel just like normal underwear. And I use these often for people who don't want to wear disposable continence aids. Depending on the severity of your husband's leakage, there are also penile clamps, which can be worn to prevent leakage. They sound uncomfortable, but I've had some very happy clients who have used these. If you were going through 3 super pants overnight, I would suggest there is a medical reason why you are passing these volumes at night. And it might be worth seeking medical advice on reducing your nocturnal urine output, as well as looking at containment options. To increase capacity, you could try placing the extra absorbency booster inside the pant, which will increase holding capacity by up to 3,200 ml with both products, which should give you quite good capacity. There are also washable absorbent products such as bed pads you could use to protect your surrounds. I see a lot of clients who develop nocturnal polyuria, whereby the body produces excessive amounts of urine during the nighttime hours. This can occur because of a number of reasons, like issues with circulation, sleep apnea, cardiac conditions and diabetes, to name a few. So your body works to expel urine at night, resulting in large volumes filling up your bladder, resulting in that bursting feeling and very large wheeze. You might try avoiding drinking too much just before bed and resting with your legs elevated for a period in the afternoon. Otherwise, management of any other chronic medical conditions could help. I would certainly mention it to your GP. Well, firstly, when you get up from your seat, you tend to lean forward and exert pressure through your arms. These actions tend to increase the pressure in your abdominal cavity and place pressure downwards into your bladder, effectively giving it a bit of a squeeze. You could then experience contraction of the bladder muscle, and if you have poor strength in your pelvic floor, this can result in urgency and leaks. It would be great to get some advice for management for your symptoms. The bladder is what I like to call a nervous organ and can be impacted by what is going on around you, such as increased stress and anxiety. There are other physiological factors at play too. Things like caffeine, alcohol, being dehydrated, these can all cause bladder issues. Having constipation will also affect your bladder function. And lastly, most people tend to experience incontinence more when they are tired, like towards the end of the day when the muscles that help control the bladder get very fatigued. I hope that's been helpful. This is a really hard question and one which would depend on your personal preference. Both are effective treatment options and both come with risks and commitment to ongoing maintenance. Botox is generally repeated every 6 to 12 months, depending on your response. Sacral nerve stimulation involves the implantation of a small device to the base of the spine. This will require follow-up appointments to assess the device and make any adjustments depending on the effectiveness of the treatment. Do read up on the literature and consider which one will suit you and your lifestyle choices the most. Firstly, having concentrated urine from dehydration is very irritating to the bladder and tends to make leakage worse. So try to drink adequate amounts regularly, and your bladder will relax and start to hold more urine over time. Secondly, in terms of disposable products, slips or nappy style pads tend to have larger capacities. You could then increase the capacity even further by adding booster pads, which can add an additional 1 litre capacity to the pad. With these two products combined, you will start to get up to around 3.5 litres capacity, which is about 7 full wees. Firstly, avoid bladder irritants like caffeine and alcohol. Keep hydrated and avoid constipation. And lastly, try starting a regular pelvic floor exercise regime to help you gain control of your bladder. If you do need to reinforce your pelvic floor on the way to the toilet, use your hand to pull up on your genitals if you're female, or squeeze the base of the penis if you're male. This should give you a little bit more time to get to the toilet, and don't wait till you're busting to go. My attitude is something can always be done to improve your comfort and management. With a complex condition like Parkinson's though, it would be really good to have an assessment with a continence specialist to come up with some treatment and management options. Continence specialists can be accessed through the local health system. Of course you can, just position them so that they are a little higher up where you're more likely to leak. The name pelvic floor exercises is a bit deceiving. It is due to the location of the muscle group rather than them needing to be done on the floor. They can be done sitting or lying down and should be done at regular intervals to keep up the muscle tone. It is very important they are done correctly though, which can be a bit tricky. A physio specialising in women's health should be able to help you with this, or there are instructional videos on the internet. In terms of general exercises, health and weight management is always good for bladder management. Just avoid anything that places weight or strain down into your pelvic region. For example, walking is great, running not so much. I'm so sorry you feel this way and you are not alone. I hear your complaints about men's public toilets and can assure you there is certainly a drive at the moment to introduce hygiene bins in men's toilets. Regarding management, you can get washable absorbent underwear which looks and feels like normal underwear. You might also find a penile clamp is a good option. They can give you freedom and peace of mind, and I have found many men like these to prevent leaks when going out after prostatectomies. This is a very common problem, I can assure you. I would suggest a non-spill urinal which has a long funnel that you can place directly over your penis and hold with a firm grip. For accidents, products these days are designed with very absorbent properties. Large capacity pads held in place inside your underwear might give you a better fit if you have issues with sizing. Use wet wipes between pad changes. Try and shower every day, and make sure you dry very thoroughly around your genitals after showering to avoid skin irritation and fungal infections. Attempting to use the urinal at timed intervals, usually 2 hourly, may also help prevent accidents. You could add a booster pad inside your pull-up and position them to cover the area you need protection. There are also pads specifically designed for double incontinence that give you good coverage at the back. Typically, I would not recommend catheters for managing incontinence unless there are significant skin issues like pressure injuries that need to stay as clean and dry as possible, or if the bladder is not emptying effectively and you need to protect the renal system. Catheters come with a whole other set of complications, including significantly increasing your risk of urinary tract infections. However, how you manage your health is a personal choice, so you could discuss this with your treating healthcare professional for a more in-depth discussion. It sounds like you have quite a complex history, and it would be worth sitting down with a continence specialist to go through all of your concerns and questions. It is a bit much for me to cover in this format, but there are plenty of management strategies available that will help with your confidence and concerns around dignity. The Continence Foundation or relevant body in your country would be a great place for you to start. And I can assure you, you are not alone. There are people from all ages and all walks of life who experience incontinence for a variety of reasons. There are nappy disposal systems with the twist and click bags that seal up used products and help prevent odours. There are also opaque scented nappy bags which can be used to disguise the contents. Having Botox in the bladder is a very common therapy used these days. They will generally start off with the minimal amount, so if this has not been effective for you, the treating specialist might like to try increasing the amount to see if the results are improved. External catheters, uridomes or condom drainage are a good solution, but you may have to try a few different styles, sizes and brands to ensure you get the best product to suit your needs. Manufacturers do generally send out samples to try. Most varieties can be worn for up to 24 hours depending on the manufacturer's recommendations, but I would suggest perhaps removing for some periods during the day or night to give your skin a break. It also helps to trim back pubic hair to avoid any disruption to the seal. Sexual activity can indirectly help with incontinence by strengthening the pelvic floor muscles, which play a significant role in bladder control. During sexual activity, these muscles are engaged and exercised, which can help with bladder control over time. This will vary from person to person, and just be aware that incontinence can also occur during sexual activity, especially if your pelvic floor muscles are weak. I love this question. The bladder, like many other organs of the body, is influenced by many biopsychosocial factors that go on in our day-to-day lives. While physiological factors are certainly at play, along with behavioural factors, what goes on in our lives and emotional experiences will also impact on the function of the bladder. I sometimes describe the bladder as a nervous organ. For example, I'm sure we've all had the experience of having to do a nervous wee before. Gosh, dementia and incontinence can be really difficult to manage. There are certain things you can try, like placing slips on backwards or using an all-in-one bodysuit. However, I should add that these are considered restrictive practices, so you would be much better trialling a toileting regime and encouraging toilet sits around every 2 hours to avoid accidents occurring in the first place. My best explanation for this is that the bladder is a little bit like a cask of wine. You finish the wine, but if you take the wine bag out of the box, you can usually get another glassful. Similarly, your bladder has areas that can collect urine when it empties. If you reposition or stand up, those little collections of urine trickle down to the bladder neck and can be passed with another attempt at voiding. This method ensures the bladder is completely empty and reduces the risk of infection. If she does tend to have her bowels open at these times, she should be supported to continue that routine of toilet sits at these times. These are principles of client-centered and client-focused care. Some foods can irritate the bladder and exacerbate symptoms of interstitial cystitis and overactive bladder. These may include spicy foods, citrus fruit, tomatoes or tomato-based products, artificial sweeteners, foods high in acidity, and some dairy foods. Adding a high absorbency booster pad inside your usual product will increase absorbency by up to 1 litre. Pull-up pants or slip-style, nappy-style pads generally offer more absorption than pads that sit inside the underwear. Firstly, when you get your pull-up out of the packet, make sure that you're cupping in your hands to make a bit of a channel in the base of the pad. This will also activate the leak guards, and that will help prevent leaks around your thighs. Otherwise, products should be suited to your individual body shape. For example, you might find the pull-up fits nicely around your waist but not your thighs, even after activating the leak guards, which can cause leaks. I find slips with tabs on the side can give you a better fit to avoid leaks because you can adjust them a bit more to your comfort. So I would recommend otherwise trialling these. Incontinence can contribute to skin irritation from prolonged exposure to urine. However, there could be other factors at play. Itching could also be because of vaginal thrush or other post-menopausal genitourinary changes, if you fall into this category. It would be worth having a checkup with a trusted healthcare professional to assess for this. Otherwise, while reducing fluids at night can be helpful, ensure you are well hydrated in the earlier part of the day. Resting of an afternoon for 30 to 60 minutes can also help the body process and excrete fluids which tend to accumulate in the lower limbs during the day. Otherwise, your body processes retained fluid when you're horizontal at night, resulting in frequent large wheeze. Managing incontinence in people with dementia involves a comprehensive approach. Some of these include scheduled toileting at regular intervals, every 2 hours for example. Ensure the toilet is easily accessible and well lit. Promote healthy bladder habits, including prevention of constipation and encouraging adequate fluid intake. Ensure clothing is easily accessible, and lastly, monitor for urinary infections. This may be indicated by delirium, which is a sudden worsening of cognition that is not normal for the individual. A pelvic floor routine can be difficult for people with dementia because they can forget how to perform these exercises and when they should do them. Firstly, limiting fluid intake can make bladder symptoms worse because concentrated acidic urine can cause bladder spasms, with symptoms of urgency and sometimes incontinence. Try to ensure you maintain hydration and your bladder should start to relax and actually hold more urine. Being aware of facilities is good, but don't get into the habit of going just in case. Try and limit caffeine and alcohol intake when you're out, as these also irritate the bladder. And lastly, you will tend to pass urine anywhere from half an hour to 2 hours after drinking, so expect to need the bathroom within this time frame, depending on how much you've had to drink. You can retrain your bladder by delaying going to the toilet if you find you are going too frequently. Holding off for an extra 5 to 10 minutes by using diversional tactics will gradually increase your bladder's capacity over time. However, going infrequently can also cause problems. Ideally, you should be passing urine around 4 to 7 times per day. Any more or any less can indicate that there are storage issues. If you have maintained a regular pelvic floor exercise regime and not noticed any difference, I would recommend seeing a women's health physio to ensure you are practicing the right technique and to check for pelvic organ prolapse. There are also vaginal weights and internal TENS machines available on the market to help strengthen the pelvic floor, depending on your preference. There are leg bags and night bags on the market which have anti-kink tubing. I would contact the manufacturers and request a free sample to trial. The inflammation and damage to the intestine caused by celiac disease can disrupt normal bowel function and cause symptoms including incontinence. I would rather look at possible triggers than jumping to colonics, and also consider pelvic floor muscle exercises and rectal strengthening exercises to help maintain control. It would also be important to discuss these symptoms with your gastroenterologist or dietitian for individual management strategies. This is a great question. There are a few reasons for this. Alcohol blocks the function of a hormone which moderates urine production, causing a diuretic effect. Alcohol can irritate the bladder muscles, causing frequent urges to urinate. And lastly, alcohol can impair muscle coordination, resulting in decreased bladder control. A perfect storm for a disrupted night's sleep. I have found this to be primarily due to muscle fatigue, namely the pelvic floor muscles that help control bladder function. Fatigued muscles may not contract as effectively, leading to poor bladder control. In addition, high-impact exercise can place additional pressure and stress onto the pelvic organs and pelvic floor. Try and avoid these type of exercises as they can make incontinence worse. Lastly, it might also be that you are drinking large volumes of water when you're exercising, which can also contribute to poor bladder control when combined with the above factors. There are a number of chronic health conditions which can cause excessive urine production at night. Managing these will be key to improving nighttime wetting. In addition, if you tend to hold fluid in your lower legs during the day, try to lie down over an afternoon for around an hour, which will assist your body to process retained urine prior to bedtime. Wearing support stockings during the day can also help circulation and prevent fluid retention, with a secondary effect of reducing nighttime urine production. Other simple steps include having most of your fluid intake in the earlier part of the day and reducing fluids 2 hours prior to bed. And obviously making sure you completely empty your bladder prior to bed. Medications are one way to improve bladder function, and there are also more invasive measures including Botox in the bladder or surgery. Have a chat to your specialist to see if any of these options might be suitable for you. Make sure that the products you use have odor lock technology, like the Daily range from ConfidenceClub. For soiled pads, tip fecal matter into the toilet before disposing. With used pads, you could use Ziploc bags or scented nappy bags to dispose of in the normal household waste. If your surrounds get wet, you can use products like white vinegar and bicarbonate of soda to help remove smells and stains. There are also plenty of odor neutralizing sprays and fragrance diffusers available to help. Your husband's history sounds really complex, and I think the best person to speak to regarding his future continence would be his specialist. However, in the meantime, building up those pelvic floor muscles should certainly help with control. There are male-specific products available on the market, including washable absorbent underwear that look and feel like normal underwear. He may also like to try a penile clamp, which can be worn for intermittent periods to prevent leaks. Thank you so much for joining me for the webinar today, and thanks so much for sending in all your questions. Please stay tuned for part 2, which will be all around youth.